Hello everyone, we are Group 13 and we are going to talk about atherosclerosis and coronary heart disease. I'm Wong Kai-hei and this is the list of our group mates. So what is atherosclerosis and coronary heart disease? It is a condition which affects the arteries that supply the heart with blood.
And let's move on to the definition of some specific terms we may mention in our PowerPoint as follows. First is arteries. Arteries are the blood vessels that carry oxygen-rich blood to our heart or other parts of human bodies. Then is plaque. Plaque are made up of fats, cholesterol, calcium, or other substance may found in the blood. Moreover, atherosclerosis is our topic today, which is a disease plaque build up inside the arteries. Plaque hardens and narrows artery over time and limits the flow of oxygen-rich blood to human organs and other body parts. Then, atherosclerosis may lead to a serious problem, including heart attack, stroke, or even death of human. Next is the definition of coronary heart disease. And coronary heart disease is the atherosclerosis related disease, which is also called coronary artery disease. It occurs when plaque buildups in the coronary artery, which supply oxygen-rich blood to the heart muscle. Plaque narrows the coronary arteries and reduces blood flow to the heart muscle, and also blood clots will form in the arteries.
So let's move on to the incidence of atherosclerosis and coronary heart disease in Hong Kong. Coronary heart disease was the dominant component, making up 66.6% of heart disease deaths. The current death rates due to coronary heart disease were 71.5 for male and 43.7 for female per 1 million pollution of respective sex in 2015. And based on population health survey in 2003 and 2004, 1.6% of people aged 15 and above had doctor diagnosed coronary heart disease.
The general mechanism of atherosclerosis will be mentioned as follows. It is mainly because of the deposition of connective tissue in the endothelium of arteries. The first reason is because of the accumulation of fat. Some dead inflammatory cells will be accumulated in the endothelium because of the endothelial cell injury. The inflammatory cells such as macrophages or lymphocytes will die and finally left in the endothelium as fatty tissues, so they will accumulate along the endothelium. Also, because of the cholesterol consumption from diet would also lead to the fat tissues accumulation. Because we eat every day, so we consume fats every day. And finally, some excessive fats will accumulate along the endothelium, and lastly lead to the connective tissues accumulation. Also, the smooth muscle cells proliferation would lead to formation of connective tissues because of the extracellular matrix macromolecules. These molecules, such as collagen and elastin, will finally form plaque, so it will harden our arteries. Such plaques would not only block our lumen and narrows the blood flow, but also will lead to arterial elasticity reduction. And finally, because of our arteries become harder, so the coronary heart disease may present and finally lead to myocardial infarction.
About the signs and symptoms of the atherosclerosis, here are the signs. First is the arrhythmia, the atrial fibrillation, the supraventricular tachycardia, the bradycardia, ventricular fibrillation, and the atypic beats. And the second, the continued high blood pressure because of the blockage of the coronary artery. And here are the symptoms. First is the chest pain occurs on the left side and the middle of the chest. They feel the pressure and the tightness and the shortness of breath because there are not enough blood that comes to the other body tissue. The third one is the extreme fatigue because there are less blood that comes to the body tissue and the muscle, and the heart palpitation because there is irregular rhythm of the heartbeat, and last there will have a heart attack because of the complete blockage of the coronary artery. There is some crushing pressure on the patient's chest, and there is pain on the patient's shoulder and arm, and they will sweating.
The development of the disease atherosclerosis and coronary heart disease will be discussed as follows. Firstly, the deposition of substances like cholesterol, fats, and calcium in the innermost layer of endothelium, and which will lead to the epithelial cell damage, and which allowing the harmful type of cholesterol build up in the artery wall. Then the body will send white blood cells to clean up the cholesterol, but sometimes the cleaning up will fail, and white blood cell will start at the affected site. This may result in building up of the plaque, and which consists of the cholesterol, macrophage, and calcium. It may increase the clotting of blood in the arteries, and which will disrupt the blood flow, which will further increase the chance of blood clotting in the arteries, which will lead to the stroke and heart attack. Second is the diagnostic method. There are several diagnostic methods in common, which is blood test, physical exam, ultrasound, and CT scan. Blood test means that to investigate the amount of sugar, fats, and protein in the blood, while physical exam is using the stethoscope to hear the unusual whistling sound, which is indicating the abnormal in arteries, and there is weak pulse below the area of the narrowed arteries. For the ultrasound test, it's used to checking the blood pressure at distinct parts of bodies, and when there is change in blood pressure, and it is indicating the obstructed blood flow. And lastly is the CT scan, which is used to find out the arteries which is hardened and narrowed.
Let's move on to the strategies of treatment. Firstly, we will talk about angioplasty and stent placements. This is a method that a long, thin catheter will be inserted into the narrowed parts of your arteries. A wire with a deflated balloon is passed through the catheter to the narrowed area. The balloon is then inflated, compressing the deposits against your artery walls. These methods can enhance blood flow. The other method is coronary artery bypass surgery. It is a process by creating a graft to bypass blocked coronary arteries using a vessel from another part of your body. It allows blood to flow around the blocked or narrowed coronary artery.
Here's the prevention of the disease. The first is quit smoking, because there are some chemicals in the cigarette, and the chemical will constrict the arteries and cause the disease. The second is eat healthy foods. Some foods are healthy to some healthy foods such as the fruits and vegetables is beneficial to our arteries, so that can reduce the risk of the coronary disease and the atherosclerosis. And the third is exercise regularly, because exercise can promote our cardiac health and strengthen our cardiac power. And then is lose excess weight and reduce stress because obesity and stress are the risk factors of the diseases. And also at last we should have regular checkups. In conclusion, we should promote healthy diet and exercise regularly because we believe that prevention is better than cure. If we have enough prevention of the disease will not be dangerous and scared. Okay. Here's our MCQ section. So the first question is, what is not the risk factor of the atherosclerosis? The answer is D, anemia, because the choices of A, B, and C both are the risk factors, and they are related to the coronary artery. But D, anemia, is just the person that lack of red cell. Okay, the next question is, what is the reason that atherosclerosis is extremely dangerous in coronary arteries? And the answer is D. All of above answers are correct. And because the atherosclerosis will cause the coronary artery disease and induce heart attack. Also, it limits the blood flow to the myocardial. So the myocardial will have insufficient blood and nutrition. Okay, the first question is, which of the following process consists of using a plastic balloon to expand the narrowed artery? And the answer is C, angioplasty. It is the treatment of the atherosclerosis. Okay, the next question is, which of the following choice is the symptom of coronary artery disease? The answer is D, all of above. When we have coronary artery disease, we will experience chest pain, shortness of breath, and also the heart attack. Okay, the final question is, which of the following lifestyle habits can help preventing coronary artery disease? The answer is also D, all of the above. And if we can maintain appropriate weight and stop smoking and do exercise regularly, we will lower the risk of suffer from the coronary artery disease. That's the end of our presentation, and thank you. And here's are the references.